Hello, my name is Arjun Gill and I'm a medical manager at Fake Hills Hospital. Today I would like to speak with you about the grad transition process. 18 to 30% of new nurses will either quit or change positions in their first year. In their second year, 37 to 57% of nurses will similarly either quit or change positions. Today we will be following the experience of George, a novice nurse on a new medical floor. Now senior staff will introduce the major theories and principles that this video is built on.
The overarching theory for the video is the stages of transition theory, which focuses on the experience of a new grad through the stages of doing, being, and knowing.
This theory will be accompanied by various theories such as the transition shock theory and the Schlossberg transition theory.
Horizontal violence and bullying are examples of the many challenges new grads face. Medication errors and feeling stressed are also major concerns. Solutions like resiliency training, therapeutic actions, and advocating for change can all help.
Nursing has changed greatly over the past 30 to 40 years. Technology, increased patient acuity, and changes in education have led to a unique transition process. New grads in rural settings also face unique challenges.
The following scenes will show my transition over several months as a new grad. We hope you find the film informative and empowering.
Today George is meeting with the manager Arjun for his first day of work. According to the transition shock theory, he may be experiencing a honeymoon period, which comprises of idealism and excitement about the role and paid employment. George is stressed that he has been hired into a part-time position, which is typical of new grads who don't often receive stable, full-time employment. This initial period also coincides with the doing phase of the stages of transition theory, which focuses on learning, performing, concealing, adjusting, and accommodating. In this stage, new nurses struggle to reconcile their educational experience with the intense, heavy workload.
Many novice nurses spend their first weeks of employment completing an orientation, like the Interior Health New Grad program, which includes classes on pay, benefits, and policies on harassment and employee support. The program also features 12 supernumerary buddy shifts. Sources like Dias and Sherman recommend support that includes further development of clinical judgment, debriefing opportunities, and skill set enhancement. Tools like simulations and linkages to leadership were also encouraged.
As recommended by ARNBC, Elaine acts as George's designated mentor as he completes his 6 to 9 month post-hire support period. George has also been formally introduced to his peers and formed professional connections. George, in the novice stage of the Dreyfus and Dreyfus model, feels focused on following the rules. In the Benning model, as an advanced beginner, George can demonstrate basic skills but requires prompting, support, and assistance.
According to the transition shock theory, the introduction to the new role can bring emotional, cultural, physical, and intellectual challenges. Role ambiguity can leave George feeling fearful and dissatisfied.
George has now entered the being stage of the stages of transition theory. Many nurses struggle with the independence and lack of support at this stage and seek validation from senior nurses, but are also wary of the intense scrutiny they face. There is a struggle to establish a work-life balance. According to Benner, the phase is marked by advances in critical thinking, knowledge, self-trust, and an ability to relate practical experience to theoretical knowledge. The nurse also begins to look beyond their own limitations to focus on the patient. According to St. Sig Gibson and Pennington, 75% of novice nurses will make a medication error.
Whoa, George, what's going on here?
Well, I was just gonna give him this medication, you know.
Okay, you're giving that medication to this patient.
Yeah.
Did you check the MAR?
No.
Look,
I'm not
that medication, the MAR, look at the patient label here.
Oh, I'm sorry. Yeah, that's my bad.
Come on.
My mistake.
Very sorry about this, sir.
Errors are often caused by substantially increased patient loads compared to during education. Patient falls and delays of treatment are also common errors. Tools like technology, adequate support, and critical thinking can address these errors.
According to the transition shock theory, novice nurses may feel a sense of loss and doubt. Problems like errors and greater supervision can increase stress and feelings of inadequacy. Reality shock, which is related to the transition shock theory, encompasses an internal conflict between learned values and the values found in the workplace. This stress can impair the decision-making ability and comprehension of the new grad. New grads in this stage become more aware of their limitations and seek help.
According to the stages of transition theory, at 5 to 7 months, many nurses experience a crisis of confidence, which stems from a fear that they will fail patients or themselves. New nurses who practice in rural settings have challenges related to fewer supports. George may also feel stress by having to adjust to the cycles and demands of shift work and having to pay off debt.
Final few months of George's first 12 months of practice is defined as the knowing stage of the stages of transition theory, which focuses on increasing confidence, reuniting with the larger community of professionals, and elements like critiquing, accepting, and exploring. Many nurses also experience a shift in support from friends and family to colleagues. Nurses also experience a frustration with the hierarchy and the perceived powerlessness of nurses. According to Benner, being able to assist other nurses and answering questions are also examples of how the nurse has grown in this stage.
At this stage, many novice nurses have a hard time shifting from a learner role into a fully practicing role with greater expectations, leadership, and a reduced margin of error, like charge nursing roles.
The Schlossberg transition theory can be applied to the process of the new nurse grad transition. With this theory, the perception of the individual experiencing transition is central. The Schlossberg transition theory would define the new nurse grad transition as an anticipated change and recommends implementing the 4S considerations. The 4 S's are the major sets of factors that will affect George's ability to cope with his transition. The 4 S's are situation, self, social supports, and strategies. George should utilize the 4 S's to situate himself and identify his strengths and weaknesses.
The work is piling on for George. He used to lack the assertiveness to delegate tasks or have the confidence to ask for help, but now he has no problem getting help from Jen. According to a study by Hussein and others, senior staff often have unrealistically high expectations of new grad nurses. They also note that new grads feel an initial lack of confidence in their skills and abilities.
Hey Jen, listen, I have to go into this room right now and I have to go do some stuff, and then if you just go wait over there, I'll come and I will help you out when I can, okay?
In this scene, George is experiencing interpersonal violence as he is rejected by the group and physically directed away. According to the ARNBC, workplace stress and anxiety, interpersonal violence, and heavy workload substantially contribute to new grad attrition.
An initiative to consider implementing to strengthen George's self-confidence in this difficult time would be to participate in resiliency training or a support program at the beginning of his employment. A qualitative study conducted in Australia observed the impact of having support programs in place for new graduates. The participants of the study all responded positively. George would be able to reinforce and develop his emotional intelligence, which is the ability to filter through one's emotions and to be intentional with one's actions. Lippett's phases of change theory could also be used in this instance as a change framework for George to advocate for himself and resolve problems. Awareness of anti-harassment policy and professional supports would also be useful. Brittner acknowledges through a leadership lens that it is vital to understand the intergenerational context and differences within the workplace. The comprehension of variances in culture directly relate to other important indicators such as staff retention, satisfaction, and buy-in. If George does not receive sufficient support, he may experience personal dissatisfaction, low self-esteem, harassment, or leave the profession. Hey, George. I know it's been a tough few months, but you've done a great job. Congratulations.
Thank you.
Have a great night.
Yeah, you as well.